welcome everybody to the July HITLAB Digital Health Symposium, and looking forward to having everyone join us today to talk about healthcare access and equity. My name is Stan Kachnowski. I'm the director of the Digital Health Program at Columbia Business School, chair of HITLAB, and visiting professor at the Indian Institute of Technology, New Delhi, India. And I'll be your chair for the session today, which will be focused on driving access and equity in healthcare using digital technologies and tools. And the program today is packed, and it would not be available today, would not be possible today without the special sponsorship and funding provided by Digital Diagnostics, a leader in the healthcare ecosystem in providing AI the right way. And so we want to pay special thanks to them for their support in today's programming. We do want you all to remember that this is not only a free program, but it's also something that's been done in conjunction with a number of partners around the world, including the Merck Global Health Innovation Fund, Medidata, the world's leading clinical trial solutions company, TeleView, one of the world's leading AR/VR surgical support companies, One True Health, a digital health company focusing on helping folks in long-term care and assisted living facilities, Colgate-Palmolive, whom you all know, and of course, ACHA, the America's Continental Healthcare Alliance, which focuses on helping people around the world understand healthcare better. So again, many thanks to our partners, and we want to make sure that everyone is going to be able to join us in this type of Zoom environment easily and comfortably. So please do be sure to join us for a meet and greet and continued discussion with speakers and attendees in the Zoom link available in the chat box, and join us there. And if you have any questions or comments during the program, during this, please do connect with me on LinkedIn and let me know your thoughts and what you'd like to see either in the sessions today or in future symposia that will be presented on the last Thursday of each month over the course of the years to come. And again, looking forward to getting your thoughts and having you included in those sessions. Our special guest today, and a special component of what we're doing today, is Donato Tramuto, a longtime healthcare leader in the United States and around the world. He's also very active with the RFK Foundation for Human Rights, and he's the founder of Health eVillages and the president of that organization as well. It's a not-for-profit focused on helping bring digital technologies to some of the world's most remote villages in some of the world's lowest income countries. And again, this double bottom line book that he's put out recently and published recently is truly transformational for leaders in healthcare and in digital health. And so we have, as he has generously donated copies of his book and personalized copies of his book, we have a giveaway. So the first attendee who correctly answers the next question in the chat box will be the winner of the first copy and the first giveaway, personalized giveaway of the double bottom line. And the chat is, the question is, healthcare spending in the US accounts for what % of the GDP? This is where you type in your answers in the chat box, and the chat box lights up like a Christmas tree in December in Rockefeller Center, and we have a number of answers. The correct answer, of course, is B, 19.7%, and growing fast. So congratulations to, I can't even roll the chat box up that fast, but it looks like Jordy is the winner. Congratulations, Jordy. Jerry Antomato, the producer of the symposium, will be in touch with you to help you with getting your copy, your personalized copy from Mr. Tramuto of the double bottom line. We have a packed schedule today, so we need to get going here. And I'm really glad to have our first guest today Blair Hirst, who's the founder of the Digital Health Review, a publication that everyone at HITLAB has grown to love and read all the time regularly, and to talk about, again, some of the major issues around access and equity in healthcare and how digital is either helping to close those gaps or is in fact expanding those gaps. And we've seen both during the pandemic. Blair, great to see you again. Thank you for joining us.
Hi, Stan. It's always a pleasure. How are you doing?
Doing well, thank you. And how are you and where are you these days?
I'm doing okay. I'm still in Brooklyn, New York. I'm surviving the heat. Just enjoying time with my family this summer.
That's fantastic. Yeah, well, good. That's good to hear. And it is definitely a tough summer to keep cool. We've seen everything around the country and what's happening there. First off, for the audience that doesn't know you, again, most of our audience does know you. You've done so much tremendous work in healthcare over the last several years, particularly in digital healthcare. Could you let people know, first of all, tell us your journey and what you've been doing, particularly over the last few years with the pandemic, and how Digital Health Review plays into that?
Absolutely. So I've been in healthcare for many years, and I've spent over 10 years actually building products for patients and clinicians. And so I have become dramatically aware of the impact and use of technology in the healthcare system and the many benefits that it has. But I've also had an acute understanding of the health inequities that have existed in the healthcare system far beyond my time and that currently exists right now. And so I started this work in Digital Health Review in part, one, to address those, but also because when I became a potential consumer of digital health, one person who is building it, one person who knows about it, I came up against barriers in actually accessing it. And so the first goal was really to, one, educate myself, and two, in the education, try and educate others. That was part of the publication or a newsletter that you were just mentioning that we have. And the second part was, as I began to understand and knew about all the digital health, but particularly the consumer health technologies that are out there in the market, I wanted to share that knowledge with others so that they could then have an easier time in navigating that. So that's really the origin of why I started Digital Health Review. And it's really to address some of those inequities, because as we have learned in the last few years, there is a decline in use of primary care providers or access to primary care providers. Actually, only 1 out of 4 Americans don't have access to a primary care provider. And so that is for a host of reasons, but it mostly affects Black and Brown individuals, those who live in low-income communities, as well as healthcare deserts. And so not having access to a primary care provider obviously leads to poor health outcomes. And the benefit of digital health to reach across borders and states and to disseminate the access of providers to those who have traditionally not been able to have them is a great benefit of digital health.
That's spot on. And maybe you could expound upon that a tad more as well, and talk a little bit about the benefits that you've observed with digital health and the impact it's making on women's health, particularly given the recent ruling on Rob and its impacts on Roe v. Wade.
Yeah, absolutely. I'll probably go back to some of the research that has already been done. So Rock Health, which I'm assuming most of the folks here are very familiar with, studied and published the fact that 2 out of 3 digital health consumers are actually adopting online health information tools. So that's above wearables and telemedicine. But what that effectively is doing is increasing the health literacy of the general population and helping them understand first what their healthcare options are, and then empowering them to choose what is best for them. And what we've recently seen also in the pandemic, and it was published in a study out of Penn Medicine, I believe, was that the rise in telemedicine has essentially eliminated, in some cases, the racial health gaps that have existed. So it's pretty clear through research, it's pretty clear through the use of telemedicine or use of other digital health tools, that there's a direct link to improving healthcare access and health inequity in the system. right now, there has been a lot of attention post the Roe v. Wade decision or the overturning of Roe v. Wade about what's happening in women's health, and as there should be. And the benefit of women health specific companies that have been founded and the dollars that have been spent in this area are going to prove essentially critical at this point. Companies like Shoe Health and Pandia Health that are providing remote birth control and abortion care options are now going to be on the forefront of consumers who live in states that aren't allowing for abortion care services or have restrictive services around birth control. And so the ability for folks who are in these areas that are now struggling to find care around a critical bodily decisions are going to have access now. And it's going to be extremely important that the dollars that are flowing to women's health companies doesn't dry up, that investors are doubling down on this and helping to grow more women's health companies in this space.
It's truly stunning, isn't it? And I think, at least for the HITLAB audience here and for the folks who are following HITLAB, it's important to understand from the medical technology perspective and the evidence base that we're following at the lab. This is going to be the greatest contraction of medical technology in U.S. history. So this is a major issue on many, many levels, and people are covering many of the issues around the human rights efforts here and the human rights consequences. But we've never seen a constriction of medical technology availability like this before in the United States. And all we know is that the ramifications of this are highly asymmetrical. We do not know what the public health ramifications will be. And at HITLAB, we're trying to really get in front of this and understand it as much as possible from the adoption of technology standpoint. But Blair, you nailed it. It is really a major consequence. And I think that just to wrap up, kind of one final question, if you could please talk a little bit about some of the current methods that are being used to reach a lot of these underserved communities and really the deserts that you talked about, and what you've seen, which efforts you've seen really be the most successful. Aside from telemedicine, you've talked a lot about that, but some of the other digital interventions that you've seen applied in these areas, and whether it's the deserts or low-income areas that have been successful in closing some of these gaps.
Absolutely. I think outside of the interventions, I think the delivery method is going to be more critical here. So what we're seeing is a lot of companies are trying to define and distinguish themselves as culturally competent care facilities or culturally competent care tools. So companies like Health in Her Hue or Zocala, which is focusing on Latino wellness visits, She Matters, which is focusing on bringing Black maternal health into the conversation, Hurdle, which is working on culturally competent mental health care. All of these companies are trying to say one thing: we understand who you are, we're going to speak your language, we're going to meet you where you are. And that, I believe, is the first hurdle, because what we're fighting against outside of the restriction that may be happening post Roe v. Wade is the need to gain consumer trust. And the first thing that we know is that if we can speak the language of the folks that we need to reach and meet them where they are, we're more likely to get them to not only use, but adopt and engage with these tools in the long term and improve their health outcomes in the long term. We're also seeing efforts in improving at-home care. So reducing barriers such as transportation for those folks who live in healthcare deserts and aren't able to reach hospital centers or clinics, bringing the care to them, bringing medical device or digital health kits to their home, and in that case, preventing some of the healthcare outcomes that are happening for those that don't have care next door to them. And so Digital Health Review is really trying to help these underserved communities discover and navigate their options so they can feel confident in finding products that are going to meet their needs so they can care for themselves or for their loved ones. And we're doing this in a variety of ways. We're trying to help them understand and navigate costs and reimbursement through our guidance, also helping with data privacy reviews, letting them know which companies have basic healthcare data protections such as HIPAA review, as well as those that have been clinically validated or have gone through evidence-based research, which we've known and have surveyed are key and critical components in getting consumers to not only just use, but adopt these tools. And so there's a variety of methods that are trying to be used, that are being used to reach these underserved communities. And I think as time goes on, we're going to be seeing more of an outline and a metric for how companies are being built for underserved communities and standards around that.
That's fantastic. Well, Blair, thank you very much, and keep up the good work. We're really, really glad to have you back on the program and really appreciate your time today.
Absolutely, Stan. Talk soon.
Take care.